Nasazeewo okujja okuzaalira wano kulw'ebirungi abasawo bye babadde bandaga n'obubi obulimu okuzaalira mu kyalo.
Every day, at least 16 Ugandan women die either giving birth or due to pregnancy-related complications. Whereas most maternal deaths that occur in Uganda are largely preventable, there are numerous bottlenecks before this problem can be eliminated entirely. Most of these problems cut across the different geographical divides in the country and are multi-sectoral. However, there is perhaps no place in Uganda where these challenges are more pronounced than the island areas of Uganda, especially the Sese Islands, Kalangala district. 28-year-old Sylvia Nakalabya is a mother of one and pregnant with her second child. She's one of the thousands of women who have to walk for many miles before reaching a health facility, a challenge they present for their low health-seeking behaviors. The islands have a total of 11 public health centers with no hospital. And Kalangala Health Center 4 is the main facility serving as a hospital, providing primary health care services to the over 5,000 inhabitants. They also have the highest HIV/AIDS prevalence in the country, currently at 27%. Currently, the health center has only 5 midwives to take care of the women who come for antenatal services, delivery, and postnatal care. Despite the dedication of these health workers, sometimes they get more complicated cases which they cannot handle.
Mothers who come here when they have already lost their babies from TBAs, because they stay there, they push like for 3 days, and they bring a mother who has already collapsed and had a maternal death in the hands of the TBA. And they brought the mother here when the baby was still inside for postmortem and to bring out that baby. Yeah, we are still having that. We don't know actually what we can do as midwives. We have social cases here even in maternity.
In Luwero district, the situation is no different. Despite attempts by government and its development partners to scale up the use of contraceptives and other family planning methods among women, the unmet need remains very high due to budgetary constraints and other factors that impact demand, access, and utilization. This calls for multifaceted interventions from all stakeholders if the Millennium Development Goals 4 and 5 targets are to be met by 2015.
A maternal mortality ratio of about 435, and then from now to 2015 is barely 3 years. Many mothers become pregnant when they are still children. Most of the mothers who come to deliver here for their first pregnancies, about 40% are less than 18 years of age for their first pregnancy. So you realize that you are dealing with children who are now mothers.
Abortion is by far the most contentious subject when it comes to women's reproductive health, yet it is the easiest to fight of all the leading causes of maternal deaths and complications.
An abortion is something which can be sensitized to community and people understand it. And on top of that, an abortion is something that is prevented. Somebody can prevent a pregnancy.
40% of mothers who go for delivery are below the age of 18 and have no source of income. The situation is made worse by the high illiteracy levels in the district.
In the normal setting, most of our people normally tend to seek treatment from either the traditional healers or traditional birth attendants, or they want to think that they can do it on their own. And sometimes this leads into difficulties because the traditional birth attendant does not have the capacity to anticipate or diagnose complications of pregnancy in the right time. And also sometimes people do not want to have patience to allow labor progress on its own. They want to quicken it. In the process, they use some drugs which can make the uterus contract much faster.
And this is where Mama Alive initiatives, A local non-profit organization wants to see action taken to ensure that every mother's health is protected and that the survival of every newborn is guaranteed. This is not an easy task, and the organization is well aware of this reality. But nonetheless, it is determined, working in partnership with other stakeholders, to try and bridge the existing gaps and aid government efforts in addressing women's reproductive health issues and address the many challenges affecting Ugandan women, youth, and children today by proactively engaging them in the solutions.
We need to look after our mothers' nutrition while they are pregnant, and to really plan for the pregnancy. That is on the social side and the people. But then government also needs to put in the hospitals and health centers to make sure that there are theaters for emergency, because emergency situations do happen, and transport to get to the health centers. And definitely, as you know, the delays, poverty, people not having money to get to the clinic, some people not attending antenatal clinics. There's a lot of encouragement that needs to be done for the women who are expecting to get to antenatal clinics early. The tendency for mothers to sit down and say, how can I tell people I'm pregnant so early, that we need to get out of their heads, so that as early as you've missed 2 periods, make sure that you get to the hospital.